My name is Erica, and thank you for joining our live interactive telephone town hall. We are hosting tonight's event to give Congresswoman Spanberger the opportunity to speak directly with you and answer your questions about the issues facing Central Virginia families, businesses, and healthcare providers amid the COVID-19 pandemic. As I mentioned, this event is an interactive forum, and we would love to hear questions from you. We'll be taking as many questions from Virginians as we possibly can live on this event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They will take down your name and where you're calling from. The next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly. You can also ask a question by submitting one through the portal below our online streaming player at spanberger.house.gov/live. Again, that's spanberger.house.gov/live. If you are watching on Facebook Live tonight and you wish to ask the Congresswoman a question, we encourage you to visit that online streaming portal so that you can submit your question. Additionally, if you would like to receive updates from our office via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. We could receive a lot of questions during this event, so if we are not able to address your question, please call our district office at 804-401-4110 during normal business hours. Again, if you have any questions throughout the event, please press *3 on your keypad, or you can type them below the streaming player. And now I welcome Congresswoman Spanberger.
Thank you very much. Hello, I'm Abigail Spanberger, and I hope you all are staying warm and safe this evening. And to those celebrating Hanukkah this week, I share my warmest holiday wishes. I want to thank you all for joining tonight's telephone and virtual town hall. To those listening in on the telephone, I look forward to answering your questions. And to those joining us on Facebook or on the internet, thank you for being here this evening. Before we begin, I would like to take a moment of silence to honor and remember the more than 300,000 Americans who have died this year due to COVID-19. Please join me in just a moment of silence. I also want to thank our healthcare workers, our scientists, our essential workers, our first responders, our public employees, and our teachers for their tireless work during this pandemic to keep our community strong and safe. This pandemic has brought hardships and uncertainty to every community here across Virginia, and my office continues to receive hundreds of requests for assistance related to healthcare concerns, housing, unemployment, and assistance with federal agencies. Please note that you can always contact our office if you need assistance now or in the future. And I know that many of you are likely following the ongoing talks on Capitol Hill focused on emergency COVID-19 relief. And as you may know, I have long pushed for Congress to deliver immediate, much-needed relief to the American people. I've been involved and worked on multiple efforts to negotiate frameworks for a negotiated deal, a deal that would pass the House, pass the Senate, and importantly, get to the president's desk so it could be signed into law and deliver the relief that our neighbors need. I remain focused on that, and we are finally at a place where I am hopeful that we will be able to pass a relief package in the coming days. The negotiations are ongoing. I'm grateful to have been and to continue to be a part of them, and I look forward to being able to announce the relief that we will be providing to the American people. Just last week, I spoke with local leaders at our area's regional food banks, and they are seeing increases of 40% in people needing assistance, and they're planning for those numbers to go up to 60% increases. So if anyone listening tonight needs food assistance or knows someone who is hungry, the Hunger Hotline is available to help people find local resources. You can go to feedmore.org and on their website, click on I Need Help, or you can call 804-521-2500, extension 631. 12 million Americans will lose their unemployment at the end of the month, and millions of Americans may face eviction, while business owners and restaurant owners across the country and our districts struggle to stay afloat amid these ongoing crises. This is a time unlike any other, and these numbers represent people, parents, young adults, people who are nearing retirement, and entrepreneurs who have put everything they have into a dream. And today, while we're working towards providing relief, we have 2 points of hope. Virginia began COVID-19 vaccinations, and we are close to finalizing that relief deal I mentioned. Relief that will provide assistance to our neighbors across Virginia and our fellow Americans. I'm grateful that Virginia Secretary of Health and Human Resources, Dr. Dan Carey, is joining me tonight. And I hope that tonight's town hall provides you all with the opportunity to ask questions about the federal and state response to COVID-19, as well as any other issues that might be top of mind for you. If you do need any assistance from my office, please visit spanberger.house.gov or call us at 804-401-4110. Thank you again for joining us this evening, and I'd now like to invite Secretary Carey to share a few opening comments and update us on the current situation here in Virginia. Thank you, and over to you, Secretary Carey.
Well, thank you so much, Congresswoman Spanberger. What a delight and a true privilege it is to be with you and with the folks in your district, the 7th District. And I'd like to cover really 3 things before we open it up for questions. First, to talk a little bit about the pandemic in Virginia, where we are, where we've been, and where we're headed. A little bit about the governor's new restrictions in order to help us stay safe. That began on midnight, Sunday night into Monday morning. And then about what you mentioned, the vaccination, because I think we're really experiencing 2 things at the same time. And I think, Congresswoman, you captured it well, and I'll just amplify that, is that in the pandemic, we're here seeing cases rise as expected. As it gets colder, people spending more time indoors. The Thanksgiving holiday, despite lots of warnings, people need connection, and we see a increase in cases here in Virginia like we have everywhere. So we really got to redouble our efforts to tamp back this pandemic in Virginia. But at the same time, there's tremendous excitement, and there should be, and hope. We're not at the finish line, but we can see the finish line in the distance, and that's where we get vaccinated, and that we have durable protection against this virus, against the pandemic, and we're able to resume a more normal life here in Virginia. So I want to say thank you to all residents of the 7th District here in Virginia. So the vast majority are wearing face masks when outside their home or outside their immediate household. We're using hand hygiene. We're keeping that 6 feet of physical distance. And if we're sick, we're staying home. And if we do those 4 things consistently, we will indeed beat this pandemic until a vaccine is present to really shut it down entirely. So where are we in Virginia? Now, the good news also is that we're the sixth lowest state in the U.S. But that doesn't mean we're where we want to be. Even though we're the 6th lowest state, infections are 4 to 5 times higher than they were just 2 months ago. And we need to redouble our efforts, as I mentioned. And I know Virginians want to help. They want to keep themselves safe. We want to keep our families safe. We want to keep our neighbors safe. And that's how we can do this together. So we are averaging just under 4,000 new infections. So that's our relatives. It's our family members, our coworkers, our community members, our church members, our faith community members. So we need to feel this personally. We need to feel this collectively. And again, we will get through this together. We are concerned because we're seeing increased hospitalizations. Almost twice as many people are in the hospital in Virginia right now. And it's not just Southwest Virginia where the infection rates are highest. It's also in Northern Virginia, here in Central Virginia, in the Valley, and down in Tidewater. So it's not a problem for that other area. It really does involve all Virginians. So I just want to thank you for what we've all done for 10 months, but we still have work left to do. So what were the recent changes? Based on increasing infections and based on what we saw during the Thanksgiving holidays with people getting together and maybe spreading. We have seen this. Our contact tracers have said it's not uh, big community events. It's not concerts. It's not bars and restaurants. By and large, folks are adhering to those distancing that's in those establishments. It's generally family members getting together, close friends getting together beyond one household. And lo and behold, that group of 10 or 12 people that were maybe watching a football game together, three-quarters of them within 7 to 10 days, unfortunately, develop an infection. That's the typical story. So we really can't mix households for that long a period of time without being, again, our mask 6 feet away, and certainly not taking off the mask. And that's why consuming food or close social interaction where you're breathing in each other's air, that's how the virus is spread, generally not from surfaces. So lastly, before turning it over to questions, vaccinations the restrictions. Social gatherings are down to 10 from 25, and that is based on the chance that if you have a gathering of a particular size, what's the likelihood that someone will be there that's infected? And that, because infections have risen significantly, the size of those gatherings needed to fall. Now, that's not an educational setting. It truly is social gatherings, and we can talk more about that if folks need clarity. It's also a modified stay-at order, staying at home if you're not working, if you're not seeking health care, if you're not helping a loved one after midnight to 5 a.m. So again, if you're a third shift worker or coming home after second shift, that's understandable. And again, that's just an extra nudge to, hey, if you don't need to be out for essential reasons, you really should be in your home as much as possible, not socially gathering with others. And then again, wear a mask for additional workers, not just, for example, restaurant workers who are serving or in the serving area, but also to keep workers safe in the food preparation area and other essential locations. So those three things in order to push us to do the right thing and to stay safe. Now, lastly, and very briefly, vaccinations. We're really, really excited about that. We in Virginia followed the CDC's recommendations to vaccinate healthcare workers first, those that are dealing with any of us who get infected. Those healthcare workers are first in line to be vaccinated, along with those that are most vulnerable, those in long-term care facilities. That's nursing homes as well as assisted living facilities, where folks who are older, not always, but multiple chronic medical conditions or unable to care for themselves, so they need that assistance. So those are the groups that are underway. The first folks were vaccinated yesterday in Virginia, and that's undergoing the distribution process. We received our first 70,000 doses in Virginia. If those are the Pfizer vaccine, and if the Moderna vaccine, another company that is in the final stages of approval, we expect that to be reviewed in public hearing tomorrow, and we anticipate, based on viewing the data, that the FDA will approve that under an emergency use authorization on Friday, and that additional vaccine, 140,000 doses. Now, there are 8.5 million Virginians, so we know there's not enough doses, so we're going to have to roll that out in a highly structured way to try to keep the most vulnerable and those that care for the most vulnerable safe. So we wish there were more vaccine, but it's amazing that vaccine is here in less than a year. So tremendous effort by the federal government, by the research community, and really it's been a worldwide effort. So we're really excited that several weeks ago, when polled, Americans indicated that only half of us would likely get the vaccine. But with the data now reviewed publicly, and with people getting the vaccine in Virginia, we're seeing that polls 80% or more are ready to have the vaccine because of the data, following the safety profile and the incredible effectiveness of the vaccine, very similar to a measles vaccine or other vaccines. Whereas the flu vaccine, very effective, but that means 60 or 70% effective, but this is 90, 95% prevention of getting the vaccine, the likelihood, a 95% reduction in the chance that you'd get an infection. And then if you did get the infection, the chances are greatly reduced that you'd have a serious illness. So that's two major benefits. So I'll leave it at that. Congresswoman Spanberger, thank you for the time to share that. And I really look forward to help answering your constituent questions this evening.
Secretary Carey, thank you so much. Again, the Secretary of Health and Human Resources here for the Commonwealth of Virginia. Thanks for joining us this evening.
My pleasure.
I'll turn it back to the moderator for the questions.
Wonderful. And this is, just to remind everyone, an interactive healthcare-focused forum. So we would love to hear your questions. If you have a question, you can press *3 on your keypad at any time to get into the queue to ask a question. A member of Congresswoman Spanberger's staff will collect your question, and we will answer as many as we can during this live event. You can also ask a question by submitting one through the portal below, our online streaming player at spanberger.house.gov/live. If you are watching on Facebook Live tonight and you wish to ask the Congresswoman a question, we encourage you to visit that online streaming portal so you can submit your question as well. Okay, let's go to our first live question this evening. We have Mr. Cardin. You are live on the phone with the Congresswoman. Go ahead and ask your question.
Yes, thank you. As a recipient of COVID-19, as my whole family got infected, I got some of the best health care available. I actually received the monoclonal antibody and was the first recipient of the emergency authorization at Henrico Doctors Hospital. However, the economic obstacles have been overwhelming. I'm just curious. I noticed that Congress at this point in time is negotiating between $0 and up to, I believe, $600 for direct payments. That does not seem really acceptable. Do you see a situation where we could get more? And do you see maybe Virginia looking to do its own stimulus as much of the other states across the country has? And maybe why haven't we addressed maybe a standalone bill to get stimulus to the people of the Commonwealth? This all or nothing proposal seems to got us nothing. And I just want to know how you feel about this situation.
Thank you very much, Mr. Cardin. Thank you for your comments. I'll begin by answering the questions specific to the federal relief package that we're working on right now, and then I'll turn it over to Secretary Carey, though not typically in his portfolio. He might be able to speak to what the conversations that have been happening at the state level. So we are at this current point in time in the end stages of negotiating another COVID-19 relief bill. As you very correctly mentioned, past relief has included direct stimulus checks to individuals across the country. Currently, we are including a provision. Now, the bill is not done and the full text is not written, but we are looking at direct stimulus checks again in this current package. We do anticipate that those will be less than the last round of stimulus checks that were $1,200. But I do believe that ultimately, as we're moving closer and closer to having this relief package done, that there will be direct checks, but I do anticipate that they're going to be less than prior ones. To get at the heart of how that makes sense, the priority was focused on ensuring relief to those who have been impacted across the board. So food assistance dollars have been a priority for those facing hunger, dollars to help with rental assistance for those who might be facing eviction. And then, of course, unemployment dollars, federal supplements to state benefits for those who've been facing unemployment, as well as an extension of unemployment benefits. Notably, during the pandemic, we've created the Pandemic Unemployment Program that has allowed for gig workers to also be eligible for unemployment. That is an important element of the relief bill that we're currently negotiating. So to get to your question, at this point, it has been kind of a look at all of the programs that matter to people that deliver relief. And in doing that, stimulus checks, which I have been an advocate for, because as you correctly note, they're important to people and our ability to get through expenses that might come up because of the virus and because of the economic impact. There is a separate standalone bill, and I am a co-sponsor of that standalone bill that is separate from a larger package focused just on economic stimulus checks. But I don't yet anticipate that bill will move forward if stimulus checks are included in this proposal, which at this current point in time, and we're getting very close to voting on this bill, I don't anticipate that they will, that separate bill will move forward, at least not this month. I'm really happy to hear that you and your family have come through your COVID experience, and it sounds as though you are doing well and healthy. But I appreciate the feedback, and certainly we have heard from many people across the district who do want to see stimulus checks. And at this point, we will be including them, though I don't anticipate that they will be at the same dollar amount as before. And if you're interested in staying updated on that, I welcome you to sign up for our newsletter on our website, spanberger.house.gov. We send out weekly legislative updates that might be of interest to you, Mr. Cardin, or anyone else. Secretary Carey, I'm going to turn it over to you just briefly in the event that there's been any discussion at the state level related to stimulus checks from the state.
The short answer is not that I've heard, and I have been in a number of those discussions. I would say from the state level that we are very fortunate in Virginia in that we haven't had to make significant cuts in our budget that would reduce services that are already there. We had to cut back on some of our increases in our new programs, but we have been blessed in Virginia with a strong economy. I realize it doesn't affect everyone equally, and many Virginia families are hurting. But compared to other states that had to cut 10% of their base budget, we were able to keep our base budget going and all the services, social services, healthcare services, and the like that they provide. So we didn't have to cut. But there is a headwind in terms of available funds at the state level based on our forecast, so that that is a headwind for a state-based stimulus. We have focused on unemployment benefits. We've focused on our expansion of Medicaid that was done by the governor with the help of the General Assembly in 2019. Over approaching 500,000 Virginians have been newly enrolled as part of Medicaid expansion, and about 75,000 of those have been enrolled since the pandemic began. So that has been a great safety net, and I realize that not everyone's eligible even for Medicaid expansion, and that private insurance and there are gaps. And frankly, this pandemic has indicated how important the healthcare safety net is. And I think you've alluded to the fantastic technology that we have with antibody treatments that weren't in existence for a disease that wasn't in existence a little over a year ago. But now we have life-saving therapies and now the beginning of the vaccine. But they cost resources, and it emphasizes how important getting high-quality coverage for all Virginians, really for all Americans, is. And that's something that we need to work on together as we move forward. So those are two points I wanted to make, Congresswoman.
Thank you.
All right, our next question is Jenna in Henrico County. Jenna, you're live. You can go ahead and ask the Congresswoman your question. Jenna, can you hear us?
Yeah.
You can go ahead and ask your question live.
All right now.
Yes, please.
Because group homes are the same as nursing homes. Are group homes in phase 1?
So Jenna, the question that I heard, there's a little bit of a sound issue on our side, but the question that I heard is, are group homes the same as nursing homes in terms of how they're prioritized for a vaccine? Is that the question?
That's a question.
Thank you so much, Jenna. Secretary Carey, could you speak to this one? I know the guidance is coming from the CDC, but is this something that you can weigh in on at this point?
Sure. First of all, you make a very good point that those that are very vulnerable to the vaccine aren't just those that are in nursing homes and assisted living. We are looking at
vulnerable to COVID-19.
Excuse me. What was that?
Vulnerable to COVID-19.
Vulnerable to COVID-19 and other infectious diseases, in that we are trying to prioritize as part of our next phase, what are those most vulnerable in other congregate care settings beyond nursing home and assisted living are very much on our radar. We haven't finalized that, but we understand the importance of that and in reaching vulnerable populations like those in congregate settings. So we do appreciate her point, and it's very much a part of our discussions. We hope to finalize that in the next week or two and be able to share that publicly. And we certainly are taking that into account and appreciate the need that she is describing.
Thank you, Secretary Carey.
Okay, wonderful. Our next question is an online question from Joan, and she would like to know, will people 65 plus with underlying conditions be a priority in getting the vaccine? And if so, when do you expect that to be?
Congresswoman, I think that's to me again. If that's all right?
Go ahead.
Well, sure. We're based on the number of, we anticipate through the first week or so of January that we will be getting approximately 480,000 doses. And we're looking at healthcare workers that are on the front lines, and those in assisted living and skilled nursing facilities, and those that work in those facilities is right around 500,000. So that is the group that we're focusing on. And then what's the next stage? And that for us is there's phase 1B and 1C. Right now, we've used the CDC guidelines where phase 1B is essential workers, and then phase 1C are those adults with multiple chronic conditions, high-risk conditions, and those greater than 65. Now, we are looking at that because not all essential workers are public-facing, and all essential workers don't have the same risk. For example, those that are working in grocery industry or in meat packing and the poultry industry that are necessarily near each other and have been shown to be high risk are likely higher risk than other workers that are working outside and physically distanced. So we're going to need to weigh in on that. We don't anticipate to have supplies to move into 1B until February, March timeframe. And then in March or so, we expect to have it to go into other high-risk folks. So we are working on a final plan. The CDC will likely release more detailed guidance, but also we're working on it very hard here at the state level to come up with a rational plan. It's not just essential workers, and this is not a referendum on the value of all of us. We all are making contributions, but we want to get the maximum bang for our buck in terms of reducing the risk for high-risk individuals because of COVID-19, and also the people that care for them, and first responders that aren't healthcare, like fire people and firemen and women, and our police and sheriffs. They're on the front line and doing their jobs. They've got to interact with the public, so they're at higher risk. But transportation workers, bus drivers and taxi drivers are also at higher risk because their jobs, essential jobs, transportation, put them in line. So we're going through those categories, and it's not going to be easy, and we're not going to make everybody happy because it's going to be imperfect. But we are going through that list, and ideally we will be consistent with other states. We're very similar to other states, consistent with federal guidance. So we'll be able to report more, but we will have that guidance in place and those plans in place well ahead of when those supplies of vaccine are available.
And Secretary Carey, just in response to Joan's question, from listening to your answer, it sounds for those who would be in the 65 and older category, that would be very late winter, early spring when we would start to know where and when we would begin to plan for them to become eligible in the next year. Is that the time frame that they should start really looking to see when it would become available for their demographic?
Well, we plan on having more information early in January in anticipation of more supplies. But realistically, to get to that group of higher risk patients and the first classes of essential workers, which is a federal terminology, we would not expect that to happen until really in February and March, but we anticipate communicating that order of priority much sooner than that. I would think in the next 3 to 4 weeks.
Excellent. Thank you.
Next, we have Dennis in Haydensville. Dennis, you're live with the Congresswoman. Go ahead and ask your question.
Good evening, Ms. Spanberger. Thank you for having this town hall meeting. I contacted your office December the 10th, Thursday at 9:40 a.m. I spoke with Will Pace, who said that Jolianne Jess Cartier was to contact me, and my concern was that with the internet, broadband, and cell phone being the new highways of business and of personal communication, that we in Goochland County, and particularly Haydensville, which is located about 1.5 miles south of Interstate 64, we have terrible internet connectivity and cell phone connectivity. And I was just interested in knowing if there's anything that you could do to work with the county officials to increase funding to give us better connectivity.
Well, Dennis, thank you so much for your question. And thank you for being in touch with our office. And I will make sure to follow up with Will and Jelena to give a more thorough follow-up in the event that you have additional questions. But I appreciate you bringing up the issue of broadband connectivity because broadband is something that I have worked on since I first arrived in the House of Representatives, representing 10 counties across Central Virginia. We have some communities where connectivity is easy and not even a thought for people. And then we've got communities like the one that Dennis lives in, where there is just not the access to broadband, even if you want it. And for some at levels that we would expect, and certainly not at the levels where someone might be able to work from home reliably or kids might be able to do virtual school reliably. Well before COVID-19, I've been focused on this issue. Investment in broadband infrastructure is an economic driver for Central Virginia. We need it from a larger economic perspective. Last year, I worked to protect valuable dollars to a program called the Reconnect program, which allows for and provides grant dollars to communities that are eligible. And we've seen a $28 million broadband Reconnect grant to Central Virginia, to some of the communities that I represent, which I was excited to see. I'm continuing to work to protect Reconnect programming and funding into the future because it is a valuable program for communities that can apply. But in addition to that, I've worked on a bill. I'm a member of the Rural Broadband Task Force here in Congress focused on this issue. And we introduced the Affordable Accessible Internet for All Act, which is a bill that would provide major infrastructure investments to bring broadband connectivity coast to coast. It's an economic issue, it's an educational issue, a healthcare issue, an agricultural issue. Certainly our farmers and producers need access to broadband technology to utilize precision agricultural technologies or to do business with their buyers and sellers. And it's an important piece. So that bill actually did pass the House of Representatives over the summer. Because of COVID and some of the other challenges that we're facing, I don't anticipate it will be getting a vote in the Senate before the end of the year, but it will remain my priority into the new year. Notably, Virginia has an incredible program called the VADI program, and the governor and the state administration has utilized CARES Act dollars, so federal funds in response to COVID-19, to put towards broadband connectivity. So in partnership, we're working on this issue at the federal level. And then importantly, Virginia is really a leader on this issue. So Dennis, we are not where I want us to be just yet when it comes to broadband connectivity, but I will say that during the COVID-19 pandemic, the one surprise for me is the fact that so many more people are willing to talk about the necessity of broadband connectivity. Communities that have never had an issue, that have never seen this as a problem, finally, representatives are now understanding how much we rely on internet, those of us who have it at home, and how much it negatively impacts those who don't, particularly when schools and businesses have been pivoting. So we will follow up with you, Dennis. Also, we have been working with some local community members, local boards of supervisors in some of the counties where we've been helpful. Last year, we hosted a broadband summit. We hosted it in Louisa County, but we had community members, board of supervisor members, business leaders from across all of our 10 counties join us, where we had speakers come from federal departments to talk about the Reconnect program and to talk about broadband connectivity writ large. And so we continue to be a resource for communities to help navigate the federal system and the grant programs and dollars that are available. And so we'll follow up with you, Dennis, to continue the conversation. But certainly this is a priority of mine. COVID has made it more clear now than ever just how important this is. And thankfully, we've really generated a fair amount of steam in this larger conversation. I maintain that any infrastructure bills we take up in the next Congress, just as in the one that we've taken up in this Congress, has to speak to broadband connectivity and has to recognize that investments that we make in that connectivity, it's just as important as the investments that our nation made in electrifying our communities 100 years ago. So that's what I'm working on. I thank you for bringing up one of my favorite topics. And I do serve on the Agriculture Committee, which is one of the committees of jurisdiction related to broadband connectivity, and work closely with my colleagues on the other committees of jurisdiction. So I will stop myself there. Otherwise, I would speak at great length about broadband connectivity, one of my favorite topics, and I will put it back to the moderator for our next question. Thank you.
All right, thank you, Congresswoman. Next, we have a live caller, Andrea. Andrea, you're live. Go ahead and ask your question.
Hi, Congresswoman, thank you so much for the opportunity to hear from Virginia's Secretary of Health and Human Resources regarding the coronavirus. My question is for you, Congresswoman, as a former CIA officer. Globally, the world is experiencing unprecedented health challenges. In the U.S., every day, news of American citizens dying reach into our homes and overwhelm our minds. In Virginia, there are many residents that are part of the intelligence community. How can intelligence community leadership better protect American citizens' health? What should be the role for the intelligence community at this time?
Andrea, this is a very interesting question, and I'm pleased and appreciative that you brought it to our attention, or to my attention. So this speaks to the larger role of diplomacy and intelligence. And in fact, the value of our international relationships. And speaking very frankly about where we are with COVID-19, we had U.S. American physicians on the ground, not members of the intelligence community, but physicians on the ground who were part of a program called the PREDICT program. So on the ground in China, there to do research, to try and be steps ahead of potential pandemics. Individuals who are going through caves, scraping bat feces and doing studies and tests to understand the types of pathogens that exist that could potentially ultimately infect humans. It's a vital program. It was a vital program and a program that was incredibly important to keeping Americans safe. Again, just for clarity, not part of the intelligence community, but part of the effort of engaging, receiving information and understanding the types of threats. Sometimes those threats are from counterparts, and sometimes those threats are from diseases like pandemics. Unfortunately, there was a deprioritization of pandemic research of this program, and U.S. physicians were pulled out of China sometime before COVID-19 struck. That was a choice of the current administration, and one that I think is deeply, deeply unfortunate given where we are now. So my role on the Foreign Affairs Committee, advocating for diplomacy, my experience as an intelligence officer, and someone who values information that can help drive the decisions that we're making. Looking into the future, I think it is incredibly important that we have strong relationships internationally, that we restore the full funding and support for programs that are derived and created to keep Americans safe here at home, and to frankly be a leading voice in the world on things like fighting pandemics and getting ahead of potential outbreaks. So I will continue to advocate for our engagement in that way, be it scientists overseas who are working hard with their counterparts, or be it intelligence officers who are working to gather information that will help people like me and the incoming administration help ensure that we can make decisions that are grounded on facts and information, and that our scientists can make assessments and risk assessments and research based on what we're seeing in the world and the threats that exist to U.S. citizens and to the greater global community.
All right, thank you, Congresswoman. Next, we have Sandy from Henrico. Sandy, you are live. Go ahead and ask your question.
So first of all, I would like to say to Representative Spanberger that I really appreciate your comments regarding the veering of the Democratic Party toward the left, that we really need to be centrist. So that's first of all. But secondly, Dr. Carey, this is Sandy Bailey. And I have a bunch of serious lung diseases, and I talked to my PCP and asked her how were we going to structure the hierarchy of patients who were under 65 who would get the vaccine, and she had no idea. She said she didn't even know when she was going to get the vaccine. So I was just curious, after the first, you said 1A, B, and C, where the process was going to be for determining how people were going to get the vaccine.
Well, thank you, Sandy. And I think I was on a call with your significant other, Chris, earlier in the day. Do I have the right Sandy Bailey? I think I do. Perhaps not. But in any event, thank you very much, Sandy, for your call. We are just getting that information. Again, we just got our plan has been in place for several months, and it's been in development since the beginning of the pandemic in January and February of 2020 of this year. And the best source of reliable information is still the VDH website. They have a section on what to expect with the vaccine and what the principles are. The CDC also has an excellent website. So those are two very reliable sources of information. And again, it's just not something that a couple of physicians or scientists have thought up. We are basing it on CDC, on their inoculation expert panel. But then we take that plan and we have an advisory group of almost 100 individuals. These are faith community members. These are ethicists. These are people from the community with lived experience. And they are also setting our plans. And then we also have something called the Virginia Disaster Medical Advisory Committee that, again, has academic folks from our UVA and from VCU and other health systems, as well as ethicists that help vet this. So we're all advising the governor as to how we protect vulnerable individuals vulnerable to COVID-19, and how do we have a framework of equity and fairness, and how do we operationalize that in the best way possible, taking into account risks, because again, highly essential workers by federal definitions may or may not be exposed to the public and be at higher risk for contracting COVID-19. So we got to integrate that, and then we vet it with a broad group of Virginians that say, yes, this is consistent with our equity framework, with our desire to help to cause the greatest good for the greatest number. So it's those ethical principles that we are tasked to put into operation. And unfortunately, we don't have, we have very, very few supplies. It's a trickle. It'll become a stream, and then it will become a river. And that'll play out over the next 5 to 6 months. So we will be communicating to the medical community and the public health community as those plans evolve. Right now, we're very clear where that first 500,000 or so doses that I outlined earlier, and it will be the health systems together with local health departments. And then actually at CVS and Walgreens have been contracted with by the federal government to go out to nursing homes and to assisted living facilities. So that's the initial plan, and that will really take over the next 4 to 6 weeks, and then we'll be ready in time for the next wave. So the plans are there. We do have the principles, but the operations is a little bit challenging because the federal government tells us when the supplies will be available, what the allocation for Virginia is, and then they will send it to the locations that we have designated, but we don't designate them until it's clear that supplies will become available. So I realize that it's frustrating to not have more information, to not know where we're going to be in May or June or April, or even the middle of January for that matter. But that's where we are and it was like that, frankly, with testing for a while until supplies became more greatly available, until we developed that infrastructure based on those supplies. So we're in a much more stable place with regard to testing and contact tracing and PPE, and we will soon be there with vaccination infrastructure and communicating all our plans to Virginia in the very near future.
Thank you, Secretary Carey. I think the continued theme of people being, I think, both excited about the availability of a vaccine, but also wondering what the order will be. On our website, spanberger.house.gov, we have COVID-19 related resources that are available. And I see a very clear need to provide some links to the CDC website and Virginia-specific information. As Secretary Carey has mentioned, in the coming weeks and months, we'll begin to see that plan more clearly. So hopefully we can be a conduit and make sure that constituents know where to look, so that depending upon which group they may be a part of, they know when to anticipate access to a vaccine.
But I would go VDH.virginia.gov does have our plan, and it has the pyramid. It's got general criteria. So there's a lot of information there already, and but we're not ready to say go to your local Walgreens and get your vaccination quite yet.
But that information, as it becomes available, you mentioned groups 1A, 1B, 1C, but then each tier will be built out on VDH.gov for people to understand when the timing might becoming for them to have eligibility for a vaccine. Is that right?
Most definitely. And right now we're in 1A subpoint 1, and then there's 2, 3, and then 1B, 1C, and then several phases of 2, and then 3 is the general public because it's generally available and openly available. So we're really at the beginning of the beginning, and that's why it's a bit frustrating. But everything we've got we'll share transparently at vdh.gov.
Great.
All right, let's go ahead to our next live caller. We have Chuck in North Chesterfield. Chuck, you're live. Go ahead and ask your question.
I was saying that it's, as of today, it's like 19 million people unemployed in the country. And initially, Ms. McConnell said that he felt that he didn't want to give us a $600 unemployment benefit because he felt that the people were being lazy and they didn't want to work, or they were not going to work. And so my question was, with the situation that it is right now, with people losing their jobs, they're going hungry, and at the end of the month this year, they're going to be homeless. Why is it, or what can you do to make these Republicans understand that people just need help for the reason, for the purpose, for right now? They don't want to be $600 for the rest of their lives. They want to get the money now to help them as they're going through now. Why is it so hard for them to understand that these same people that they beg to vote for them, that they won't fight for them now?
Chuck, thank you for your question. And I want to be very clear. I'm fighting to ensure that there are resources and support to people who are experiencing unemployment. It is the stories that I have heard from the people that I represent, hard-working Americans and Virginians who had good jobs, and then COVID-19 struck, and there are some businesses that are gone forever. And with those businesses that have gone out of business because of the economic impact of this virus, those individuals are working hard trying to find work. But if you are in the restaurant industry or the live entertainment industry or small businesses that have just seen a decreased number of clients walking through the door because of the economic and public health crisis that we are facing, those individuals need help. Those individuals need relief as they look and towards a future where they can get back to work. And they need relief in terms of unemployment. And to be very clear, I support unemployment support to those who have lost their jobs and to gig workers. Particularly during this pandemic, gig workers have been particularly impacted just as regular employees of businesses have. I support ensuring that we are providing nutrition assistance because people who are experiencing unemployment or hardships, reduced hours, are also experiencing hunger. And I mentioned it at the outset. We've seen a 40%, or locally, food banks are reporting a 40% increase in the number of people requiring help, and they're planning for the possibility that that could go higher, up to 60%. That's why a relief package has to include food support and nutrition support, and eviction and rental assistance, because individuals who have lost their job, and Chuck, I know I'm telling you something you already know, but I want you to know how important this is. And every day that I have been involved in these negotiations with fellow House members and with senators and with Democrats and Republicans, these are the programs that I am fighting for. And rental assistance, so that we as a nation do not experience a housing crisis, that individuals do not experience eviction, that children who are already in uncertain educational circumstances because of school closures and hybrid openings are not also facing a family's eviction, particularly during at any time of the year. It's horrible, but in the winter months, it's beyond unthinkable during a global pandemic. And I am supportive and fighting for additional funds to the PPP program, the Paycheck Protection Program, because it is incredibly important that we support small businesses and employers so that they can keep their employees employed, and that we are not seeing an ever increasing number of Virginians or Americans facing unemployment. So what we are looking at right now, as of right now, through the negotiations, we have agreement on lengthening the time for unemployment eligibility and increasing or providing federal supplement to state unemployment benefits. Right now, we have negotiated $300 in federal support per week. That is different from what has previously been available. But that supplement, that federal supplement, is vitally important, something that we've been working towards to ensure that it's there. I appreciate you bringing up this question, because one of the biggest challenges of this pandemic that we are seeing is that people are impacted so differently. There are people across our communities who have lost their jobs, lost their businesses, lost their livelihood, and times are dire. There are other people with the flexibility and the availability of internet to work from home, and it's a hard time, but it's different. That insecurity that exists for those facing eviction, food insecurity, and unemployment is just there are desperate times for many Virginians, and I appreciate, Chuck, you bringing up this question and allowing me to speak to it a bit more. And just affirm to everyone listening that I am fighting for these programs because they matter to people, they matter to kids across our community, and frankly, they matter to the larger economy, because when we have full deployment of a vaccine, when we are able to re-enter what feels like a normal economy, we need our small businesses to be there. We need people to have been able to survive this time, not lose their houses, and we need to help people through this horribly uncertain, desperate time. So, Chuck, thank you for your question. What we're working on right now does include additional unemployment. It isn't at the $600 level, but it is increased federal dollars each week.
Wonderful. Thank you. We have time for one more question this evening. We are going to take Linda from Glen Allen Live. Linda, you can go ahead and ask the Congresswoman your question.
Hi. First of all, thank you very much for a really interesting forum that we could hear from both you all as well as the community at large. I think this is excellent. A quick question on the vaccine. So I know that there are 2 doses that each person is supposed to get. But what about after that? Is there some sort of frequency with which you would have to, get repeats, like a flu shot every year, or is it a one and done kind of thing? I don't know that I've heard that anyway.
Linda, that's an excellent question, and I'm going to put it over to Secretary Carey to answer that one, because I'm curious. I think I know the answer, but I want to hear it from him.
Well, that's a great question. And like many things with COVID-19, we're not entirely sure the answer. It looks like the vaccine stimulates a very, very strong immune response, one that we would expect to be durable for multiple years. However, we're not entirely sure. We've got to give the vaccine to, like we've done in the clinical trials, to tens of thousands of people in the U.S. and internationally. And then time will go forward. We'll see, and likely part of their, not likely, I actually know that a subset of those in the clinical trials will have their blood checked for a long period of time, at least out to 2 years, so we get a sense of how durable that is. But that's the same reason very few people have documented second cases of COVID. It is documented, but it's still relatively rare. And we're still recommending that those who have had COVID-19 to go ahead and get the vaccine, because the vaccine does appear to stimulate a very robust immune response, even perhaps stronger than having had the disease itself. So we're not sure how long an individual who's had it has good levels of immune response, antibodies that, should the virus gain access to the body, that it kills the virus right away before it has a chance to get going again. So the short answer is we're not sure. It could be something that we have to get every 3 years, or a booster every 5 years, or there could be, we hope this is not true, but there could be that it mutates like influenza, and that there's a new strain that we need to be vaccinated against every year or every other year. So we've got to learn. It's a great question. We don't know the answer, but we're optimistic that we will learn that in time to know, say, in 2022 and 2023, do we need to have all get vaccinated again, like we do for influenza, or it's going to be more like tetanus, a 5 or 10 year booster would be fine. So stay tuned, but I'm convinced that we will know, because we're actively, never has anything been investigated so aggressively. And we'll have the answers. We just don't know them because we need to see tens of thousands of folks where we are a year from now and 2 years from now to know whether we need to be vaccinated again. But great question. Thank you.
Okay, we now have time for your closing remarks, Congresswoman, if you'd like to go ahead.
Please, thank you so much. I want to thank Secretary Carey for joining us today. Again, Dr. Dan Carey is the Secretary of Health and Human Resources for the Commonwealth of Virginia. and he provided, I think, great information for those curious about the vaccine and Virginia's response. To the people of the 7th District, I want to thank you for joining this telephone or online town hall, depending upon how you've chosen to join us tonight. I love doing town halls in person. I love speaking face to face with constituents. But during this ongoing public health crisis, I am grateful for you being flexible and attending events such as this. I hope that it's been informative. And I just want to make sure that people know that they can get information from our office, from my office, on the issues and the questions that you all have. Spanberger.house.gov is our website. And we have resources related to COVID-19, issue area resources discussing unemployment, benefits, food assistance, information about the virus. And I would urge you all, please go to our website. Information's available. If it's helpful, I am so glad that we are able to help. If you need additional assistance, please call our office, 804-401-4110. If you need assistance with anything, we are here to be a resource. And if you are having any challenges with federal agencies, Social Security, the VA, anything else, please, OPM, be in touch with us. We're here to help. I want to note that Secretary Carey spoke about vdh.gov as a resource for tracking what's happening here in the Commonwealth of Virginia as it relates to vaccine deployment and all things related to COVID-19. And I also want to, as I stated at the beginning, anyone who's experiencing food insecurity, feedmore.org, there's a hunger hotline that covers counties throughout Central Virginia. That hotline or that website can help direct people in need to the nearest food pantry or location for them to gain assistance. I thank you for your time this evening. I continue to work focused on the COVID-19 relief package that is so vitally necessary to our neighbors, to our communities, and to our larger economy. And please, I also welcome you to sign up for our newsletter. We send out information once a week that I believe and hope is valuable to you. And I also welcome you to share your stories and provide information and experiences. Everything that I do as your representative is based on the stories and the people in Virginia. So please be in touch and tell us your story, tell us your needs so that we can be working for you. And so, again, I'm so grateful for the opportunity to represent you in Congress. And I hope that you found this evening useful and helpful. Again, thank you so much to Secretary Carey for joining us. And Secretary Carey, if you want to have any closing remarks.
Well, thank you. I thank you so much, Congresswoman, for your leadership, for your support of Virginia in so many different ways, and broadband in particular. Just great leadership together, supporting each other with the state and the governor's initiatives. Very, very mutually supportive. So thank you, and its impact for Virginians. The last thing I will simply say is the basics done well. It's keeping that not emotional distance, really not social distance. It's physical distance of 6 feet or more, wearing a mask when you're outside your household, and hand hygiene, exactly. And I'm at home, so I left it on the front desk when I came in. I'm home without my mask. It's downstairs. And staying home if you're sick. And the second thing is we're asking everyone to join over 800,000 Virginians who've downloaded COVID-Wise, a free app on both Google Play and at the Apple Store, the App Store. Exactly. And it's
on my phone, Secretary Carey.
I have it here, and it was the first in the nation to use the Google Apple joint effort it doesn't use geolocation, it doesn't track where you are, it just keeps track through Bluetooth low emission, just like it picks up your headphones or a speaker. It can tell when you're about 6 feet or so away or less, and it keeps track if you've that individual, based on a code, an anonymous code, has been there for more than 15 minutes over 24 hours. And if that individual turns positive, they will get a key, and everyone who met that criteria, not just in Virginia, and actually in the next week or so, it'll be across the nation in case you had a visitor or someone who was a bit close. So it's a great way to to connect with in an anonymous way with our fellow Virginians and really our fellow Americans to keep each other safe. So please do it. It's gotten great reviews for folks who are very skeptical about apps and geolocation. Said this is great. It keeps everybody safe and it's totally anonymous and no record of who is actually, just that you were close and it knows who you are to contact you. So took a little bit of time there, but COVID-wise, please download it.
COVID-wise. It's a program that will help alert you if you've had extended contact with someone who later tests positive anonymously, so you have that information. Again, to the people of the 7th District, thank you for joining us. Secretary Carey, thank you for being part of the conversation. To everyone out there, I appreciate the privilege to be able to represent you in Congress, to work on your behalf on a day-to-day. And I hope you all are staying safe. I hope you are doing well. And I hope you'll join us for our next telephone and virtual town hall. Thank you so much and have a good evening, everyone. Stay safe.